When perceived contractions as painful sensations, it is necessary to resort to drug analgesia. Disclosure uterine pharynx for 4 to 8 centimeters, often accompanied by weakening functional activity of the cerebral cortex, leading to painful contractions, and can be seen as indications for drug analgesia, given that childbirth is carried out. Psychoprophylaxis, and not only analgesics but also anesthetics, antispasmodics, sedatives and antihistamines more correctly. Consider that not just anesthesia and anesthetic allowance, the medicines used and methods of analgesia should reduce pain without exerting adverse effects on the woman in childbirth and the fetus without suppressing the birth activity. Question about the method anesthetic benefits. Always decided individually. Here, for example, in the first stage of labor, there is a reborn woman. Childbirth flow normally, and at first she applies methods of psychoprophylaxis. But the contractions become more frequent, painful sensations are stronger, but only after elucidation of the condition of the birth canal. You can start medication. Anesthesia. The neck is smooth, opening uterine pharynx 4 centimeters available. Conditions for the start of analgesia. It is advisable to apply the most common combination method analgesic with antihistamine. For example, you can use Promedol and Pipalfen. Promedol, synthetic analgesic with pronounced sedative and antispasmodic effect applied. 20 to 30 milligrams. Pipalfen, an active antihistamine drug, sedative and potentiating effect of analgesics. 50 milligrams applied in one syringe with Promedol. The mixture is not injected later than 2 hours before delivery to avoid possible respiratory depression in a newborn. Contractions become almost painless. A girl is born healthy. Childbirth did not leave the woman painful impressions.